Welcome to Between the Sheets, the podcast where we're going to cover a variety of topics related to sexual health and wellness. I'm Dr. Stephanie Zwonitzer, your host. I'm a nurse practitioner and have been in practice since 2017. I have my Doctor of Nursing Practice degree, and I specialize in urology and sexual health. I am so excited to explore all of the various topics related to sexual health and wellness with you in a fun, spicy, educational, and non-judgmental manner. So come on. Let's get between the sheets. Hey everybody, welcome back to the Between the Sheets podcast. I have a great episode for you on pelvic health today, and I have an amazing guest. Dr. Brita is a board-certified physical therapist and pelvic pain specialist with a passion for helping others achieve optimal health. She holds a bachelor's of science in psychology from George Mason University and a doctorate of physical therapy from Maymount University. A Northern Virginia native and a lifelong athlete, Dr. Brita's personal experiences with injuries, fueled her love for physical therapy early on. After over a decade in orthopedic physical therapy, she expanded her expertise to women's health, driven by her own struggles with endometriosis and bladder pain. As a mom of four, she understands the unique challenges women face in healthcare. Dr. Brita founded Pelvic Healing and Wellness Physical Therapy to focus on pelvic pain, endometriosis, bladder and bowel, and sexual dysfunction, and pre- and postpartum care. Her practice emphasizes hands-on manual methods and a patient-centered, holistic approach, utilizing techniques such as Graston, dry needling, therapeutic cupping, myofascial release, joint mobilization, muscle energy techniques, and trigger point release. Welcome, Dr. Brita.
Oh, thank you so much for having me, Stephanie. It's great to be here.
Yes, I'm so excited to have you on. Pelvic floor is something that is such a great topic that so many women need help with, and men too, but today we'll kind of focus on the women. It's funny because for so long it was just do your Kegels.
Yes.
Everybody do your Kegels or your Kegels, depending on how you want to pronounce them where you're from. But that's really not it, is it?
No. Yeah, the pelvic floor is just so complex. Tons of muscles. I guess my other pelvis. Tons of muscles all in here. It's connected to your core. This is the bottom of your pelvic. The pelvic floor is the bottom of your core. But,
Okay.
there's back muscles, there's leg muscles, inner thigh, glutes. All of those compose your pelvic floor. So just doing, I say Kegels. Just doing those will be a disservice to patients because there's just so much incorporated in. And so many muscles that, everything's connected. So, the old saying, the hip bone's connected to all these muscles are super connected, and we have to focus on the whole body. So that's what I love. A lot of patients will come in and they'll be like, hey, is it just pelvic floor? I'm like, no, we need to look at your posture. We need to look at how your foot's hitting the ground, how you're breathing, which is huge. Any scar tissue, just go through the whole past medical history. Simple things like constipation, and if you sit all day, which sadly, we do, but yeah, just trying to get in a lot of movement breaks and see how that can affect you, because we just weren't designed to sit all day. And it just has a huge impact, as does stress. And it's just, it comes at us in all different directions. So
yeah, for sure. So for me, working in urology, I relay patients to you guys when the women are having pain with sex, women are having pain that's similar to UTI type symptoms, but they're not testing positive for infections. Certainly postmenopausal changes and issues there. So what are the biggest issues that you see coming in for pelvic floor physical therapy?
I would say, the biggest issues, a lot is pelvic pain. Of course, that can interfere with pretty much every aspect of your life.
Yeah.
Whether it's, intimacy with, your partner, or, just trying to get through the day, or trying to, do the things that you like, going out with your friends, or just, going on a walk, or things like that. So probably the biggest one is pelvic pain, but then, pelvic floor dysfunction that plays in. So whether you're having leakage or um, your like maybe prolapse can also come in,
Mm-hmm.
especially if you've had multiple births vaginally, or not. I see a lot of patients that they just want to get their core back.
Mm-hmm.
And which drives me crazy is that pelvic floor physical therapy is not a standard of care. So typically after having a baby, especially C-section, you're just pretty much, after 6 weeks told, okay, go return back to everything. And
Yeah,
it's such a disservice.
it really is.
Yeah, there's scar tissue there, like muscles have been overstretched and shut
Mm-hmm.
down. 90% of postpartum moms have pain with intercourse the first time they try.
Mm-hmm.
So that shouldn't be. You should
Right.
be prepared and, getting to know your body. Things change.
Mm-hmm.
Not that you can't get it back, but it does take a lot of work. And just learning to, embrace the changes and appreciate your body.
Mm-hmm.
Our bodies are miraculous, and um, but so many changes happen, and if you're having any kind of discomfort or pelvic floor dysfunction such as leakage or any of
Mm-hmm.
those issues, then it's if you can't resolve it on your own, it's crucial to go see someone that can help you.
Absolutely. And I have patients who kind of balk at me when I'm like, look, especially for your stress incontinence or your pain with sex,
Yeah.
there aren't medicines that I have that are going to help you with that.
Yes.
It's pelvic floor physical therapy. And they look at me like I am an alien. Like, how dare you recommend pelvic floor physical therapy? I came to you as a provider, fix
Yeah.
it. And
Yeah.
I'm
The
like, no,
quick
no,
fix.
no, no. Like, I promise this is the way to fix it.
No.
Yeah. So what would you tell somebody, what to expect when they come to pelvic floor PT
Yeah.
and why it's so important that it's going to be so beneficial?
Yeah. So, if you've ever had physical therapy, it's similar where, we'll check out, your posture, your any, weaknesses, flexibility, strengths, things like that, any scar tissue or limitations in mobility of tissues, especially around the abdomen. And then, the sessions are, give or take about an hour. You can bring someone with you. A lot of times, it's, uncomfortable going into your first visit. So I always welcome, whether you want to bring your mom or your partner, like your best friend or
Mm-hmm.
whoever. It's just a different kind of session. It's not, I try to make, at our office, make it comfortable. There's
Mm-hmm.
blankets and there's dim lighting and there's music playing and just
And it's
cozy.
private.
It's private. Yeah.
Yes.
It's a very relaxed environment
Mm-hmm.
where, it's almost, you just, once you feel comfortable with your therapist, and that's so important. And if you're
Mm-hmm.
not feeling comfortable, then it's probably not the right one for you. But yeah, just trying to feel comfortable, and we work on stretches and strengthening, and just getting to really understand why the dysfunction is, and just really getting to the root of the problem. But
Mm-hmm.
usually it's a combination of things. So, for pelvic floor dysfunction to happen, it's not just one thing, but
Mm-hmm.
it usually is a combination of things. So
Yeah.
working on all these things, typically the sessions can go from 8 to 12 sessions. Sometimes it's shorter, but depending, how long
Mm-hmm.
it's been going on, and what your goals are. A lot of times people have like 5 goals, and I'm like, great, let's do it.
Yeah.
Let's do it.
Yeah. Yeah. And I'll have some patients who are like adamant that they can't go to physical therapy because it doesn't work into their schedule or whatever. I'm like, can you please just fit a couple sessions in so that you can learn the exercises correctly? And they will provide you with homework and things like that to do at home. But just like any type of training, it's not beneficial if you're not doing it correctly. So I really appreciate having pelvic floor specialists that we can send patients to. Talk to them about the internal component for women, because that can be intimidating going to the pelvic floor physical therapist for the first time. Women are usually only thrown up in stirrups and touched in that area by their gynecologist or their urologist, maybe their OB. So what can they expect when they come to you, and how do you make that comfortable for them?
Yeah, that's a great point. Coming from my own personal experience, I had pelvic pain as
Mhm.
a teenager and, throughout college and grad school. So oh my gosh, I went through medical trauma of, people not knowing what's wrong. And, so I just really make sure like you're comfortable. And there's tons of things that we can do prior till you feel you're comfortable.
Mhm.
And you have every right to, say that you're not or change your
Mhm.
mind. But we just go at your pace. So, but yeah, so basically, with the pelvic floor, there's all these muscles, right? So your bladder, which I love how you can take this one out. I wish I could do that for many people. But yeah, your bladder sits right here in your pelvic floor. So when you look at it, there's all these muscles in here that surround the bladder. So we work on releasing those. There's layers of your pelvic floor. So right through here is more the first layer. And then, of course, I can take this out, but not normally.
For those of you that are listening and not watching, Dr. Brita is using a pelvic model right now to show us this. So pop over to YouTube and watch it on the video when you have a
That's
chance.
fine.
Yeah.
Yeah. So, yeah, so there are different layers of the pelvic floor. I kind of think of it as a flower, just kind of peeling back the layers. And that's kind of how we work. We'll work, over the abdomen, the inner thighs, and then we'll get to the first layer, which is really the like external part of, the pelvic floor through here. And then getting through the first layer of the pelvis. So it's just basically like the first part of your finger. So just right through here, going through the pelvic floor. And then to get to the second is, a little bit further in. The third is more like near the tailbone, back through here, just releasing those. There is a pelvic wand that you can use to release as
Mm.
well. For patients that are really just like, they don't want, to be touched, a lot of times I'll just show them on the model how to do it. And then they can try at home, or we can do a telehealth or, a mobile
Mhm.
a visit like that where I just kind of talk them through it. So it's, whatever's comfortable for you.
Mhm.
Everybody's different. So,
Sure.
just kind of work at your level of what works for you, what you're comfortable with, and just step by step, because it is a little bit intimidating. But usually after the third or fourth visit, patients are like, where they didn't even want to like get undressed, like they're just so comfortable with it. And you just build that level of trust, and you're already seeing the results, so you're like, okay, this is
Yeah.
working. And I just think building trust with your provider is so important. So I like to build
Yeah.
the trust first, and then just go from there, just like any relationship.
Yeah.
Yeah.
No, I think that's great. I haven't talked about this on this podcast yet, but I had incontinence my entire childhood, and luckily I'm from a very small town, and so my parents were teachers in my schools,
Oh.
and so I always had extra clothes in their rooms. I
Oh.
always had a sweatshirt I could tie around my waist, things like that,
Yeah.
and bless their hearts, my parents for the longest time would be like, "Well, just stop playing and go to the bathroom and stuff." You know what I mean? Like they
Yeah.
didn't know, and I was a
Yeah.
kid at
They
the
didn't
time, and so
know.
all of
Yeah.
those things. But when it kept going through high school, and then I got married very young, and so I went to pelvic floor physical therapy as an 18-year-old, and
Oh my
so
gosh.
had not really had any vaginal exams or anything like that. And so it was very intimidating for me,
Yes.
but she took that time to build that
Yeah.
trust. And when I tell you it was such an amazing outcome for me, it was incredible. I did take medicine for a little while, but I haven't taken medicine since my late 20s. And I
Yeah.
rarely, if ever, have an issue besides maybe some jumping on the trampoline or something, you know?
Yeah.
But not that constant urge incontinence that I used to have. And so, I try to do my exercises at home and things like that. And that's one of the other things I stress with my patients. And you can talk
Yeah.
more about it, but is that pelvic floor physical therapy, in my opinion, is not like you had your shoulder replaced, you go through your 12 weeks of physical therapy, you're
Yeah.
done, you're good, go live your life.
Yeah.
Pelvic floor physical therapy, you need to keep doing those exercises whether you've graduated from PT or not.
Yeah, I usually compare it to like if anybody's been through back rehab, where their back has gone out. It's like you don't just after you're better, get to stop doing your stretches and stop doing core work and exercising, because the moment, you lie around for 2 weeks, that pain's probably going to return. And although you might be able to kind of do new things and, kind of venture out but you still need to exercise, bottom line,
Right.
and make sure all of your muscles are strong. And it's not just strengthening. A lot of times people will come and their pelvic floor the muscles are just very tight and they don't want to, relax. And so we have to get through that first before we
Mm-hmm.
can start doing strengthening. And a lot of people will come in, well, I've been doing Kegels and,
Yeah.
it's making it worse.
Yes.
And it's because your muscles are so, tight and they're not able to fully expand to their full capacity, that no matter how many you do, it's not going to work. Like, we have to release those first. So,
Yeah.
And what I like to do is, because I'm obviously not going to be with you for, every week, is teach you all the skills so that you're able to practice those in between. And then you become the expert of your own body.
Yeah.
And you're like, oh my gosh, I had a flare, but I knew what to do, or I had some leakage, but I, was able to engage and do different things. But you have to dissect the whole, like, what's going on through your day. What is
Sure.
your posture like? What are you drinking? What are you
Yes.
not drinking? Are you dehydrated because you don't want to, gosh, I just saw that today. It's like scared to drink water. Scared to drink water because you're afraid you're going to pee, and you just get into this cycle.
Yes.
Now your urine's super concentrated, your bladder's angry.
Yep.
But you just don't realize a lot of what you're doing is making it worse.
Sure. Yeah.
So,
And I've had patients just get so mad at me when I tell them, if you drink more water, you will actually pee less and leak less.
yes.
And they're just like, no, that's not how it works, because if I drink, I'm going to pee. And I'm like, I get it. Like, intake is output, but I promise you, your less concentrated urine will make your bladder much happier, and that will make you much happier.
Right. It is hard to believe, and you kind of have to go through it to believe it. And have that trust, right? So,
right. Absolutely. So let's talk through a couple issues that people come through. So if a woman is coming in for incontinence, she's leaking, maybe with sex, maybe with the urge or stress, what kind of are some, generic exercises, obviously without, getting too specific, because each woman you're going to individualize for. But what are some things that somebody with leaking could do even at home right now to start improving?
So a lot of muscles that are accessory muscles to your pelvic floor and our thighs. So, I have a ball somewhere, but squeezing, I'll just use my pelvis, squeezing the ball in between your legs is working accessory muscles to your pelvic floor. Anytime I exercise, I always tell people exhale with exertion, because if you're holding your breath, you're going to be putting pressure on your pelvic floor and your bladder. So that's one. I love bridges as long as it doesn't bother your back or, any issues with that. So assuming you don't have any SI joint issues or things like that, bridging is good because those are your glute muscles back here. Glute supports the posterior part of your pelvic floor. So those are really important. And then balance is important, because if you're walking and things like that, or if you have leakage with running, a lot of this, where you're on one leg and then kind of transitioning to the next, there's a lot of pressure going through your pelvis. So stabilizing yourself, in single leg stance or during balancing is important. And then obviously core, but that gets a little bit heavier, is like figuring out, am I engaging my lower transverse abdomen? Like, what am I engaging? A lot of people engage up here.
Yeah.
And then that puts more pressure down. So that is something where I recommend having someone assess you to see how you do engage your core muscles. And then of course, pelvic floor, that gets a little tricky as well, just to figure out, am I engaging it? What am I doing? Am I just squeezing my butt?
Yeah.
Yeah, I'm like, do you know how to engage your? Everybody's usually like, I don't know if I'm doing it or not. So that's where we come in, and we can kind of feel to see what muscles you're using. Are you able to engage? Are you able to relax? And then breathing is so important, as I mentioned.
Mm-hmm.
The deep diaphragmatic breathing allows you to relax your pelvic floor and expand those lower diaphragm muscles and your abdomen. And so those are all good ones.
Perfect. So then what about the woman who is having pain with sex? She pees perfectly fine, no
Yeah.
issues there, but she just doesn't even want to have sex with her partner anymore because every time causes her pain.
Yeah, so that is a very common, oh my gosh, it's like 1 in 3 women at some point.
Wow.
I think, well, I mean, sometimes they say 1 in 4. I like to go 1 in 3 because a lot of people just won't admit it when they do have it,
Sure.
or they'll just be like, "This is normal. It's supposed to hurt," and it's not. It
Sure.
shouldn't hurt. So we have to look at the whole body again. A lot of times, is like, what is your day like? Are you stressed? Are you able, what is work like? Are you nurturing your body? What is your relationship like? Is there any like you know trauma from the past or trust issues? Sometimes that can play. Sometimes like lubrication
Mm-hmm.
um can come into play. Like, do you naturally have lubrication, or there's tons of great ones out there. So finding one that's right for you, that can really make a huge difference. Or is it pelvic floor dysfunction, where the muscles are not expanding and relaxing like they should? Something like pelvic floor therapy would be helpful for that. And
Mm-hmm.
there's dilator therapy, which I strongly recommend. Don't just go out and buy dilators, but do work with a therapist so you can at least figure out how to use those as well.
Mm-hmm.
Then looking at, your nutrition, what are you putting in your body? Because if you're constipated, your rectum sits close in to your, where your bladder is and your uterus, and all of that gets congested. It's going to really close in on that space, and the muscles and your digestive system will suffer. So constipation can play into it as well. How much you're moving. If you sit all day, all those muscles are getting compressed.
Yep.
And you need blood flow down there.
Mm-hmm.
So, are you moving? Are you taking movement breaks, stretching? As we get older, our muscles just aren't as flexible.
Yeah.
And you just start to feel it, like, oh my gosh, my hips are stiff. Having stiff hips and, stiff back will affect your pelvic floor as well. So, I'll work on a lot of like mobilizations to the hips and to your back, and myofascial release to those muscles, so that you can freely move in different positions, and it's not, you're not experiencing pain. Any kind of pain will create restrictions, because that's what your body does. If it
Mm-hmm.
experiences pain, your muscles will naturally tighten up to protect, because that's their job.
Yeah.
Um, and so I'm doing that. I will tell you, hormone changes can come into play as well, especially if you're a new mom. If you're breastfeeding, that can, not only are you recovering postpartum, but with breastfeeding, you'll lose a lot of your natural lubrication. Your estrogen is a little bit lower, and everything's just kind of, your body's just depleted a little bit. And
Right.
so, you might need lubrication when you never needed it before. And this isn't like a permanent thing, but, that might be, or there might be scar tissue from having a little bit of, tearing if you delivered vaginally.
Sure.
The scar tissue can play, or C-section scars. You can actually have pelvic floor pain if you have a C-section scar. And it is so important to work on that scar,
Yeah.
when you're cleared and ready, because there's deep fascia that connects throughout your whole body, and the
Mm-hmm.
deep fascia in your abdominals connects into your pelvic floor, and through your back and your inner thighs, and all the way down to your feet, and even up in your jaw. Like, if you're really, really stressed and you're clenching your jaw, what do you think you're
Yeah.
doing to your pelvic floor? So,
Right.
or
Right.
your shoulders. So, I love working with a massage therapist. I mean, you know, I just think our bodies just go through so much every day.
Yeah.
So yeah.
Yeah, no, I think that's awesome. And yeah, I think you're right. Like it is a whole body thing. And it really definitely changes throughout our life and through different phases in what we're doing. Our hormones, postmenopausal
Yes.
is very different than postpartum.
Yeah.
Yeah. So, and I send a lot of my older ladies for pelvic floor PT, whether it is because of pain with sex or leaking, but also just like you said, like balance is such a big thing, and the constipation can be an impactful thing. So, it's really the holistic approach. Like, I love that that's what you base your practice on, because it's not just one thing that is
Yeah.
setting this off.
Yeah, and I think, for pelvic floor dysfunction or just pain in general, it's usually not just one thing. And then and you sometimes you just don't even have that time with, a regular practitioner to really go through or no, usually I get like nobody's ever asked me that question like,
Yeah.
oh yeah. So, that's where I love this like one-on-one for an hour is that I really get to dive deep and figure out what is truly going on with your body, and
Right.
go through all these different things so that we can really fix the problem.
Yeah. And I've gotten plenty of golden nuggets from my patients coming back from pelvic floor physical therapy and being like, oh, they said this. And I'm like, I'm going to start using that.
Yeah.
So it's been very beneficial to my own practice
There
too.
you go.
Yeah. Yeah. So it's wonderful. Well, I really appreciate you coming on today. I appreciate getting to hear this. And I think that it's such a beneficial type of therapy. And, it's sometimes difficult to find a pelvic floor physical therapist in a certain area or that takes your insurance. So I just always encourage my patients, don't give up, keep looking, because there are really, really great outcomes with pelvic floor therapy. So thank you, Dr. Brita.
You are very welcome.
All right, everybody. We'll see you next time between the sheets.
Thanks.
Thank you for listening and spending time with me today. You can catch new episodes of Between the Sheets every Wednesday, because what better way to add some spice to your life than to have a new podcast on Hump Day? We will continue to explore common, uncommon, and taboo topics related to sexual health and wellness. Please send any comments, questions, or stories to podcastbetweenthesheets@gmail.com. That's all one word, podcastbetweenthesheets@gmail.com. Have a great day. And remember how important it is to discuss these topics with your friends, your family, and of course your partners. In fact, you can like, follow, and share this podcast so they can see it too. See you next time for more sexual health topics between the sheets.